When a baby is born, that's not the end of the story. For you, as a clinician, it's actually the start of one of the most critical races in medicine. We're talking about the first 42 days, the postnatal period. What happens in this window can literally mean the difference between life and death for both mother and child. So let's dive into why this period is so absolutely crucial. Let's just start with a number that really puts things into perspective: 75%. That's how many neonatal deaths occur within the very first week of life. 3/4 of them. That number alone tells you everything you need to know about the weight of responsibility that falls on us as healthcare providers in those first few days. So, how do we manage this? Well, we break it down into 3 distinct phases. First, you've got the immediate period, the first 24 hours. This is the danger zone, the highest risk for sudden, acute problems. Then there's the early phase, from day 1 to day 7, where our job is all about vigilant monitoring for things like infections. And finally, the late period, which takes us all the way to 6 weeks, where the focus shifts to recovery and setting up long-term health. All right, so let's get into it. The first 42 days. We're going to break down exactly why this period is such a make or break window for the survival and the future health of both mother and baby. You know, it's so easy to focus all our attention on the newborn, but we absolutely cannot lose sight of the mother. Just think about this for a second. Nearly half, 45%, of all maternal deaths happen within just 24 hours of giving birth. This really hammers home the need for immediate, sharp, and vigilant care right from the get-go. And that brings us right to our first major focus: protecting the mother. This isn't just about celebrating a new life. It's about actively hunting for, identifying, and managing a whole range of complications that can pop up with terrifying speed. So what are we actually looking for? This chart tells a really clear story. Look at that big slice. Postpartum hemorrhage is the #1 killer at 27%. This is a fast-moving bleed that needs immediate, decisive action. After that, you've got sepsis and hypertensive disorders, like eclampsia. These are the threats you have to be ready to manage at a moment's notice. And these risks, they change over time. In those first 24 hours, you're on high alert for things like a major hemorrhage. But as the weeks go on, the picture shifts. We start to look for things like postpartum depression, which can affect up to 1 in 5 new moms, or chronic issues like anemia. And that right there is why a complete clinico-psychosocial assessment isn't just a nice to have. It's an absolutely critical part of postnatal care. So, the bottom line is knowing what to look for. These right here are the non-negotiable danger signs. You need to have these burned into your memory. Heavy bleeding, a sudden fever, a severe headache that could signal preeclampsia, convulsions, or any trouble breathing. Any one of these is a red alert that demands immediate, urgent action. This is the kind of knowledge that saves lives. Okay, let's pivot and focus on our other patient in this critical duo, the newborn. Just like the mother, the newborn has a very specific set of needs, and you have to have a keen eye for any sign of distress. The foundation of newborn survival really comes down to these 4 pillars. Thermal protection is huge. A cold baby can go downhill incredibly fast. Clean cord and eye care are all about blocking entry points for infection. Getting breastfeeding started early gives the baby colostrum. It's basically their first immunization. And of course, tracking their weight is our best and simplest way to know if they're getting enough nutrition and growing properly. So, what are the biggest threats we're up against? This chart lays it out pretty clearly. Complications from being born too early are the #1 cause of mortality. Right behind that are infections, and then birth asphyxia. As a future clinician, your ability to manage these 3 things will have a direct impact on how many newborns survive. And just like with the mom, you need to know these newborn danger signs by heart. Trouble breathing, a baby who just won't feed, that yellowing of the skin from jaundice, a temperature that's too high or too low, or any change in consciousness. These are all massive red flags. There's no wait and see with these symptoms. You have to act. Okay, we've covered the clinical side of things, but your clinical skills don't exist in a vacuum, right? Let's zoom out and see how this all fits into a larger public health system, like the one in India. Understanding this framework is key to making your clinical skills effective out in the community. At the heart of India's approach is something called the RMNCH Plus strategy. It's a bit of a mouthful, I know, but the idea behind it is brilliant. It's all about creating a seamless continuum of care so a person gets support all the way from adolescence, through pregnancy, and into their child's early years, with a huge focus on those first 1,000 days. A huge part of making that strategy work on the ground is this schedule of mandatory postnatal home visits. And these aren't just random dates, they are specifically timed to catch problems right when they're most likely to appear. A visit on day 3, for example, is perfect for catching jaundice when it often peaks. The day 7 visit is a key window for spotting early signs of infection. So, how does this all happen? Well, it's a team effort, really. You have ASH workers who are the frontline health activists doing these crucial home visits. You have programs like Janani Suraksha Yojana, or JSY, which gives cash incentives to encourage women to deliver in a hospital. And then you have the IMNCI protocols, that's the Integrated Management of Neonatal and Childhood Illness, which gives everyone a clear, standardized playbook for treating sick kids at the community level. So we've talked clinicals and we've talked systems. Now let's bring this all back to you. How do you take all this information and turn it into action? What is your role in making sure every patient gets quality care? I want you to just pause for a second and really think about this question. We throw around the term quality care all the time, but beyond the checklists and the protocols, what does it actually look and feel like for the patient in the real world? Well, a good way to think about it is to break it down into these 3 pillars. You've got structural quality, that's the basics, like trained staff and clean facilities. And outcome quality, that's the end result we measure, like lower mortality rates. But that middle one, process quality, that's where you come in. That's all about using evidence-based practices and, just as importantly, clear, empathetic communication. It's the art and science of that clinico-psychosocial assessment we talked about. At the end of the day, this is about so much more than just passing an exam or remembering a protocol. It's about making sure that every single mother and every single newborn gets the best possible start in life. Quality postnatal care is what makes that a reality. So as you move forward, I want you to ask yourself this. What's one thing you can do starting today to improve the quality of care you provide in this critical 42-day window?